Is the best way to do the census, is it to go out there and meet with the HR or them, or send it?
Typically, I would send it to the employer. They usually have that information in their payroll system. So it's usually already there. So if they are definitely using a payroll vendor, they're going to have that information already. If it's a startup and they don't know, then yes, probably sitting down with the employer. I know some brokers will make kind of like just a Word document that has like name, date of birth, do you want coverage? Do you not want coverage? Why do you not want coverage? And then just hand it out and collect it back. And then we can just put it into a spreadsheet.
So the payroll companies, they can just pull a report that has all that already?
Yes, 100%.
So that's really easy.
It makes it very easy.
For anybody with a payroll.
Yes. The other thing that they could possibly do too, if they currently have coverage, they can also go in through their employer portal into their current carrier. So they can go into Blue Cross Blue Shield and actually print a census out of Blue Cross Blue Shield. So we can get the data that they currently have. We may not know like if they have waivers or if they have any new hires. So those would have to be added afterwards. Yeah. But they would at least be able to get that core information. So we could even do it that way as well. I know United does the same thing. Aetna will also do the same thing. So they should be able to find that data. And some of the carriers actually put it right on the renewal as well. So that helps too. And again, as you guys are going through any of this process, if you have a client and you're like, hey, I have this client, what do I do?
And the group's different.
Yeah. I would be more than happy to always walk you through scenarios.
I haven't worked for a while, but does it matter for full-time employees or
It depends on the employer. So that is an employer decision. So some employers actually choose to cover part-timers down to the hours of 20 or 20 or more. Some only do full-time. Under the Affordable Care Act, any employee that works more than 30 hours per week is technically eligible for benefits under the Affordable Care Act. So that's usually what employers are using is 30 hours per week.
And a positive with the group side is you could do group all year round. You don't have certain enrollment periods like you do on the Medicare side, on the IFP side, individual family plan side. Group, they could pick up insurance as of July 1st, even if they don't have coverage right now. So they don't need a special election period or anything like that. You could do that year round. I know you guys are used to the Medicare side where you could only do it at certain times. So this is something to do in your off season outside of your crazy Medicare season. So that's awesome with group. And you don't have to do as much fact finding. You guys are very personalized with who you meet with on the Medicare side. You find out who their doctors are, what their conditions are, what their medications are. That's not really something that you guys will have to do on the group side unless it's the owner or the owner's wife.
That's true.
But usually all the employees, they leave that up to them. They don't really have a decision on the plan that they're going with or the carrier they're going with because the employer's making the decision.
Correct.
How much does the employer have to pay for part of the health insurance?
Yes. So every single carrier will have a different contribution guideline. Some of them, like an Aetna, will go all the way down to like 20% that they have to contribute. Others will require up to 50% or more. The other caveat with that is also participation. So if you are going out to an employer, they also have to meet participation guidelines. And those are going to vary carrier to carrier. So again, some of them is 20%, some of them is closer to 70%.
And she has all.
I have a cheat sheet.
Yes. That's why we didn't want to print out all this stuff. We figured it was easier to send stuff over to you, and then you could distribute it or put it in your library, whatever it is.
Yeah. It's called a frequently asked questions, and it will go very much line by carrier, and every single thing that you could run into. Does this carrier cover 1099s? Does this carrier allow management carve-outs? Does this carrier allow husband-wife groups? Like there's so many different scenarios, and we have all of that on our cheat sheet. So we have that. The other thing I wanted to point out, and I know Andrea, we kind of glossed over, in this little packet too, we provided you guys with the carriers that we represent on an individual side and then also on the group side. You will notice that on the group side, like I said, if a client is looking for pretty much anything and everything, we almost have every insurance carrier that we represent. So, and just so you guys know, because this is often a misconception about using a general agency, is that people don't use general agencies because they think that we're getting some of your commission, right? That is not correct. So in our world, what happens is you would get 100% of the commission, whether or not you use a GA or you went direct to the carrier. So you're going to get your commission no matter what. BGA, on the other hand, goes to each one of these carriers, and we set up a general agency contract. So it's a separate administrative contract where that is how we get paid, because we kind of become a middleman between the broker and the carrier.